Welcome back to Caring for Kids on WJR, presented by the Children's Hospital of Michigan Foundation. Once again, here's Larry Burns.
Dr. David Rosenberg is Psychiatrist-in-Chief at Wayne State University School of Medicine and the Detroit Medical Center. Dr. Rosenberg's work has been featured on ABC's 2020 and is often sought out by national media as an expert on the issues of child psychiatry. Dr. Rosenberg received his medical degree from the University of Michigan School of Medicine in our great state of Michigan. Dr. Rosenberg, welcome to Caring for Kids.
Good to be here.
We appreciate it very much, and I know you're really busy, but May is Mental Health Awareness Month, so we thought it was a great time to have you on our show.
Absolutely.
And our Children's Hospital of Michigan Foundation is proud to partner with you on several of your and your colleagues' research projects. And can you share with our listeners maybe some of the impact or some of the things that regarding that funding that you'd want them to know about?
The impact has been huge, and this partnership that we've had with the Children's Hospital of Michigan Foundation is our most important partnership, without any doubt. I think we've talked often how children and adolescents with behavior problems, mental health problems are the diagnostic and therapeutic orphans of American healthcare. And in a system that's dominated by the politics of who will pay the bills, those without votes get short shrift, so we have Medicare rather than Pedicare, and literally millions of American children who don't have access to adequate mental health care. And I think it's through partnerships such as we have with the Children's Hospital Foundation in the areas of pediatric bipolar disorder, depression, anxiety, ADHD, autism spectrum, and obsessive compulsive behaviors that we're making a true impact. And the foundation, actually, that support proved critical in our ability to ultimately get fairly large grants from the National Institute of Mental Health.
Excellent. And so the foundation's playing a role in sort of that seed money for even more impactful research in the future. So that's what we want to do and continue to do it. And one of the things that I'm proud to be part of in Detroit and the foundation is to be part of Children's Hospital. And can you tell our listeners a little bit about what makes Children's Hospital of Michigan a leader in mental health as it relates to kids? And Wayne State, too, because they're involved together.
Children's Hospital and Wayne State, they are part of the same family and partnership, and it is something extra special for me. I literally feel that growing up in the area, the Children's Hospital of Michigan saved my life. When I was very young, I had a severe allergic reaction to penicillin, anaphylactic, and where did my parents take me but to the Children's Hospital of Michigan? And so in many ways, I have felt a particular affinity to Children's Hospital from the time I was 7 years old.
Recently, we were in your office, and you were telling me a little bit about some of the 2020 experiences you had on ABC. And the internet, as we all know, is everywhere, and these days our reliance on phones, computers, tablets, you name it, is increasing. And I understand you're conducting some research about the negative impact that children face due to spending way too much time online. And can you share with parents, grandparents that are listening a little bit about this work?
We are finding that in some cases, the internet becomes such a master that someone can literally become addicted with similar types of behaviors and findings, both in behaviorally and in the brain, to what we might find in someone who's addicted to another substance, drugs, alcohol, or gambling. The good news is that our preliminary research, some of which has been supported by the Children's Hospital Foundation, suggests very strongly that with digital fasts and appropriate treatment, these brain abnormalities may be reversible and may normalize. The caveat being that even after a digital fast or treatment, that this is a long-term process, that the family really has to be involved in removing the internet addiction or getting it back in control. The goal of treatment is to essentially reverse the process so that the internet again becomes a servant, not the master.
Right.
Because what we're finding in the brain is that the brain is literally hijacked in internet addiction, but the terrorist in this case is a virtual one, which is ruthless,
right.
and it's everywhere.
Yeah. Wow. And one of the things that I hope the foundation and mental health now being one of our priorities, as you know, is that we continue to fund research in this area. And what are some of the other focus areas of your current research that our listeners might find interesting?
Well, I think this is really a strong testimony to the foundation because we know how hard it has been to get support for many mental health problems in children. There remains stigma. We're working hard to reverse that. But I really, again, have to applaud the foundation for putting mental health at the top of its list. And there is so much that we are doing. We're fortunate at the Children's Hospital of Michigan to have the only pediatric center in the country that has both high-field, very sophisticated, powerful MRI imaging and also PET scanning, positron emission tomography scanning, in a pediatric center in a children's hospital. Other places have this type of technology, but it's only in Detroit, only at the Children's Hospital of Michigan, that you'll find this in a pediatric center. Not in Los Angeles, not in New York, not in Boston. You have to come to Detroit.
Yeah, that's awesome. And that's another reason why the foundation and Children's Hospital of Michigan are working together for things like the work you're doing. And so one last question I had, we're talking with Dr. David Rosenberg, who's psychiatry in chief at Wayne State University School of Medicine and the DMC, is I know we have a lot of grandparents and parents listening, and what quick advice, if any, can you give parents who are concerned about a child's mental wellness?
The most critical thing is to make sure that they get a comprehensive assessment by a trained behavioral health professional, a psychiatrist, a psychologist, some developmental pediatrician. This isn't something that you can phone in. You need to have a comprehensive, good assessment to find out exactly what's going on, and equally important, what's not going on. There are a lot of labels out there, and half the time when I get a referral, it's clarifying a diagnosis that I either think is not accurate or is incomplete. We say in our textbook on pediatric psychopharmacology that the single best predictor of a good outcome, of a good response to treatment, is having an accurate diagnosis, something that's a lot harder than it sounds.
Yes, and so if your grandchild is acting different than they normally do, then don't ignore it. Look into it with a trained professional.
Absolutely.
Great. Dr. Rosenberg, thank you very much for being on Caring for Kids, and even more importantly, thanks for all you're doing for the kids of our community and our country.
Thank you. I appreciate it.
And we'll see you soon. That was Dr. David Rosenberg from Wayne State University School of Medicine and our Detroit Medical Center. And coming up next, we'll speak with Nance Roy, Clinical Director of the JED Foundation, when Caring for Kids continues here on the great voice of the Great Lakes, News Talk 760 WJR.